This is COVID update, and we are continuing with heart disease. This is part 2. Heart disease will be a 3-part series, and it'll be a 4-part series if I can get a patient experience. I'm working on a patient to talk to us. My name is Dr. Valdi Crowder, and I'm an emergency medicine physician. I've been practicing for 30 years in emergency medicine. I'm currently the director of emergency medicine in Harrisburg, Pennsylvania. On Twitter, Instagram, there are my handles. The website is AskDrV.us, and today is May 20th. Let's get started. All right, the presentation is 20 to 25 minutes, followed by Q&A. Total about an hour. We usually end around 9 p.m. Everyone is in listen mode, and you can ask questions in the chat icon or in the Q&A. And you can put questions in the chat icon and in the Q&A as we are going along. So the intention is to keep webinar participants informed with COVID-19 science that will help you and your family stay healthy during this pandemic. And we've expanded that to include a wellness topic. You will leave the webinar motivated to create or improve an action plan for you and your family, or you'll be motivated to create an action plan for your broader community, like a homeowners association, or a church, or a business. Now, my commitment in this was to actually take us all the way through the pandemic. And we have basically gotten to the end. So we will be doing this until the end of May. And then once I get to the end of May, I'm going to work on a podcast where we're going to totally focus on wellness topics. So please make sure to send me any topics that you want to know about or understand, etc., because I will add them to the podcast that we're putting together. All right. So globally, there's been 165 million cases of COVID-19 with 3.4 million deaths around the world. In the United States, we've had 33 million cases of COVID-19 with just over 600,000 people dead. Dr. Fauci actually, explained that the pandemic has undeniably laid to bear the effects of racism in our medical system and in our overall society. He testified during a Senate Health and Education and Labor and Pensions hearing. And we appreciate him for doing so, because it's important for us to understand that racism is just, it's more than someone being called a name. It actually impacts your livelihood, and it actually impacts your life. When you look at masks, they're mandatory indoors in the areas that are orange. In the areas that are bluish, there's no restrictions. And then in Colorado, they are required in some areas. Walmart, Disney, Target, and Trader Joe's have relaxed their mask policies unless required by local and state regulators. So they basically have said, we're following whatever the local laws are at this point. Governor Abbott of Texas, interestingly, signed executive orders banning state entities, including schools, from ever actually requiring face masks in the future. And what is important about this, and why I include these slides when I see things like this, is I want you to think about what's going to happen with the next pandemic with these laws on the books. With these laws on the books, the next pandemic is going to kill even more Americans. Iowa did the same thing. She signed bills prohibiting mask mandates in schools and businesses. Now, interestingly, some schools are struggling to get students to return after months of remote learning. One of the, especially in a lot of minority areas and lower income areas, students are very scared or concerned. There's a lot of schools that are opening, and the kids do not feel comfortable returning. And I tell people that, I think it's important for all of us. This has been a scary 18 months for everyone. And everybody's going to kind of come back at their own pace. Some people are going to, rip off the mask and be back to life as normal immediately. Other people are going to be a little bit more tentative, and just allow people space to sort of navigate things at their own pace. All right, as I said, don't let your guard down. I want to talk specifically, we got into a big discussion about monoclonal antibodies last Tuesday. So I want to just go over what the new criteria was. I didn't have time to actually set up the slides last time, but monoclonal antibodies provide symptomatic relief. And you're also 70% less likely to be hospitalized, and you have fewer long-term effects. So you're less likely to be a long hauler with monoclonal antibodies. This is a screening tool that we used to have up until this week. So up until this week, the criteria to actually get monoclonal antibodies was that you had to have chronic kidney disease, diabetes, some sort of immunosuppressive disease, or be on some sort of immunosuppressive treatment. And then you also had to have a BMI over 35. And just to give you an idea of what that is, you know, if somebody is 5'6", they have to almost weigh about 240 pounds or so at 5'6" to have a BMI over 35. Now, the new criteria is all of this. So now, anybody over 65, a BMI over 25. Now, a BMI over 25 is somebody who's 5'6" and maybe 160 pounds. So it's very, very significant. Pregnancy, kidney disease, cardiovascular disease, diabetes, Down syndrome, dementia, liver disease, current smoker, former smoker, current or former history of substance abuse, immunosuppressive disease, which was there before, history of stroke, sickle cell, any sort of neurodevelopment disease, any sort of medical related technology dependence. So you have a colostomy, or you have a tracheostomy, or you require CPAP. So again, the exclusion is people that are less than 11 years old or less with severe COVID symptoms and ICU level of care required. So even admitted patients. So again, I want to just show like this vastly expanded. I'm unclear why we were not doing this back in December. But again, a lot of this has to do with the emergency use authorization and how quickly the pharmaceutical company actually expands the indications. As I said, respect COVID-19. It can be caught in a matter of 45 seconds, and about 80 to 90% of the people who get exposed to it actually catch it. Going quickly to the vaccines, there are 3 vaccines: Pfizer, Moderna, Johnson & Johnson, with the Pfizer and Moderna vaccines being mRNA vaccines. Now, someone had asked me about mRNA vaccines providing neutralizing antibodies in the nose. I believe it was a Laura Garrett MSNBC article. So I want to make sure that I go over that as we talk about this. Johnson & Johnson is not a messenger RNA vaccine. It is what we call a viral vector approach. And it is a one-shot vaccine. So what is important is COVID-19 is what we call a beta coronavirus. So COVID-19, SARS, MERS, which was a Middle Eastern respiratory disease, those are all beta coronaviruses. So what they're saying is the messenger RNA, which is the top 2, the Pfizer and the Moderna, they may provide you future protection against beta coronaviruses of any kind. So it is important, and those neutralizing antibodies live in your nose or your nasopharynx area. So that is what they're actually talking about. It doesn't actually specifically, so it doesn't talk about your ability to actually give someone else COVID-19, which is why they're recommending that you still be careful when you're around a lot of other people. So FDA is reported to set to approve and did approve the COVID vaccine for 12 to 15-year-olds. I think we now have a couple million 12 to 15-year-olds that are vaccinated. Currently, about 22% of the US cases involve children or teenagers. This is really, really important. I really, really recommend that children and teenagers try at all costs to avoid getting COVID-19. Although their immediate their immediate symptoms are not severe. What I am seeing is a huge explosion in adolescents psych cases. And I can only imagine that it's related to the high concentration of COVID-19 in the brain cells of those that have actually been exposed to it. World Health Organization says rich nations vaccinating kids is a moral catastrophe amid a global shortage. Now, again, these are all moral decisions and these are all ethical decisions, and people can weigh in on both sides of this issue. But Dr. Tedros believes that wealthy countries should share dosages before vaccinating kids. Now, I know a lot of wealthy countries like the United States have shared their doses and have donated doses of COVID-19, millions of doses of COVID-19 to the COVAX program at the World Health Organization. All right, so let's talk a little bit about India. Their cases seem to be possibly going down a little bit, which would be a great thing for them. I don't know if it's going down or because of the cyclone, were they testing less? So that is always a question. We'll know the answer to that in the next week or two. But we had a lot of conversations about India and India as a worldwide leader in vaccine manufacturing, and also what is happening there with the population and these infections being so out of control that they are producing variants. So let me go over a couple of things. So this is actually the vaccine supply that will be produced in India in 6 months. So these are the 6 companies that produce vaccines in India, COVID-19 vaccines. And this is the number of doses that they will actually supply in a 6-month period of time. So if you add all of that up, that means India produces or can produce around 4.5 trillion with a T COVID vaccines in a year. So they are, I wanted people to understand what a major player India is and actually producing COVID-19 vaccines. So they're a major exporter of vaccines, all types of vaccines. Every vaccine that you think of, India is a major exporter and manufacturer of these vaccines. And they've been a major exporter for decades and decades now. So now they are looking at, maybe we should stop exporting as much. Maybe we should begin importing and use it, use these vaccines for ourselves. So what has happened is, they have contracts that they have agreed to fulfill. And then they're looking at, after that, not fulfilling them and trying to use them for internal use. And of course, that's worrying other countries that rely on the production of the India vaccines to vaccinate their populations. So they're beginning to look at how can we actually prioritize our local needs and not send these vaccines out. This is just an interesting article. It was in PBS, and it was COVID-19 is out of control in India, where most vaccines are made. How did this happen? And basically, India decided to sell the vaccines because they felt like they had actually conquered COVID-19. And they felt that they had beat it, and they had not. And so they entered into a lot of contracts and sold a lot of vaccines while really they were going to need them. So what are they doing now? We've all talked about this, Ivermectin. So one Indian state will offer Ivermectin to the entire population, even as the World Health Organization warns against its use as a COVID-19 treatment. Again, Ivermectin is has been studied to a small extent, but not to a huge extent. It certainly, if I had limited choices, and I had run through what is standard therapy and was still suffering, then obviously people try a lot of things. And I don't think that it's a bad thing to try when you actually have gone through all sorts of standard therapies that have not worked. So this is what we're seeing in their sort of last ditch effort to kind of really help their people. They were dealing last week with a cyclone coming, and this may again be why we see the cases drop, because usually what happens is a lot of the testing centers shut down during things like this, and also people shelter in place, so they actually spread it more. So often after a situation like this, you'll see a rampant increase again. So now, the variants coming out of India are double mutations, what we call double and triple mutations. And that's double because they're double the number of mutations and triple the number of mutations. The first one, B1617 variant, has arrived in the United States. It's currently 3% of the coronavirus cases in the US. During the midst of all of this, Governor DeSantis says he will pardon Floridians charged with violating pandemic rules. And again, I think we have to really look at putting politicians in place that are going to actually protect our health and not actually encourage misbehavior during health emergencies. And to that extent, we have a physician who he and his staff proudly rejected wearing masks, and the health department came in and promptly shut them down and told them to stop practicing during COVID-19 if they could not wear a mask. I remind people that there's millions of people that may look healthy to you on the outside, but you don't know what their health is on the inside. Some of them may be, and the most compromised people are those that are transplant patients. We are seeing where transplant patients and immunocompromised Americans are not fully vaccinated, or they're not fully protected by the vaccine. And so although the vaccine helps, it is not as protective as it is in the rest of us. And so again, you just never know what's going on with the people around you. So I always remind people, be considerate. Coronaviruses are more extraordinary in the real world. They actually work better. And they seem to do even really good with some of these, at least some of the initial variants that we had. So that is actually good. So now you're vaccinated, you can get outdoors. Now we've got even indoors, as long as it's not large groups of people. Obviously, we're not getting back to concerts and sporting venues and things like that, which would be nice, but we're not there yet. Dr. Fauci said in the future, COVID-19 infections will be small blips, and we won't go through what we went through previously. So you are fully vaccinated 2 weeks after your last shot. That is when you were fully vaccinated. Dr. Fauci, fully vaccinated, still will not eat inside of a restaurant. I'm sort of with him on that. Again, I usually eat at restaurants where they have some sort of indoor-outdoor feature to them. Maybe by the wintertime I'll feel differently, but that's what I'm doing now. In total, we've administered 279 million shots have gotten in people's arms. That is phenomenal. That is absolutely phenomenal. The states with the highest vaccination rate are Vermont, New Hampshire, Massachusetts, Connecticut, and Rhode Island. Lowest vaccination rates are Mississippi, Alabama, Georgia, Arkansas, and South Carolina. Unvaccinated folks are the ones that are going to be driving the coronavirus surge moving forward. I just remind people that if they're not vaccinated, please don't get out there and do as you see other people doing. There really is a big difference, and the virus is still going around. All right, so let's go to our wellness topic, heart disease part 2. So just remember, we were talking about the heart, and the heart is a muscle, and the muscle actually pumping through a network of arteries and veins to give your body the blood and oxygen and nutrients that it needs. The coronary arteries that feed the heart, its nutrients run across the surface of the heart. And then the heart sits in a little sac, and that sac is called the pericardium. So this is kind of what it looks like. This is when you actually take the pericardium off. This is what you see underneath once you actually take the pericardium off. And there's 4 chambers. There's the right atrium, which receives the blood coming back from your body. The right ventricle, which pumps it into the lungs. the left atrium, which receives the blood coming back from your lungs, and the left ventricle, which is the strongest chamber, which pumps it all the way out and around all of your organs and everything in your body. So I just want to remind you that's what we were talking about. So let's talk about what I wanted to deal with today. And we're going to go over blockages. And we're going to get to the heart and the brain. We won't be able to get to the aorta. I'll save the aorta for Tuesday. But we're going to talk about the heart and the brain. The blockages in the heart are really your coronary arteries. And then the blockages in your brain is what causes a stroke. So now, normally, your blood vessels are open and patent, and blood is flowing like the picture on the left. Now, the way this whole thing gets started is you get a little tear in the lining of your arteries. And this just happens, it could happen because your blood pressure intermittently got high. It could even happen with normal exercise, just regular, aging. And when I say aging, it doesn't really take much. Just, 30 years old, you can get a little tiny tear in the lining of your arteries. Then the clot begins to accumulate. And that clot is sort of a mixture of cholesterol and also platelets. So what happens is that plaque starts off and it's kind of small, and then it builds up and it builds up, and then it may sort of rupture. And then as the blood is passing through it, you actually get clot that actually builds up, or platelets that actually builds up. Now, when you look at this, a lot of people said, I had a question on the last webinar about why would you use aspirin if you're 50 and you're healthy? So there was a study where they looked at 20-year-old gunshot wound victims. And they found that at 20 years old in inner city America, because of diet, most 20-year-olds had like 30 to 40% plaque. That's significant, right? So I don't want people to think that this occurs when you get old. This actually can begin occurring at a very young age, right? And a lot of it depends upon diet, weight, diabetes, but you can be perfectly healthy. And this can also occur. So by the time you're 50, the assumption is whether or not you're healthy or not, you have some plaque, right? So the goal is how to keep that clot from bulking up like that. And the main thing that keeps that clot from bulking up like that is aspirin. And that's the safest thing, and that's the best thing. And that's really the best thing, even if you think you have chest pain and you're waiting for 911 or you're trying to get the amp to the emergency department, pop an aspirin. All righty. So this kind of shows a normal heart and arteries and everything and what it looks like. And then what does it look like when there's plaque buildup? So when there's plaque buildup, there's a narrowing of the lumen. And sometimes too, there's kind of like some fat around the actual heart itself, right? So I just wanted to show sort of a side-by-side comparison of normal and not normal. Okay, so now when the plaque builds up, it forms the plaque will rupture and forms a blood clot. And then what happens is the flow of the blood is actually blocked completely or near completely. And that is when you have symptoms of either chest pain, shortness of breath, sweating, may go to your arm, may go to your jaw, etc. When the area in your heart does not get enough blood, then what happens is the heart tissue dies and it forms scar tissue. And the scar tissue does not pump like the regular heart. So just to kind of show it again, in a different cross section. Now, what I wanted to actually show here down at the bottom to the left there is what a normal EKG beat looks like. It says normal underneath. The next one in the middle says ischemia. Now we spell ischemia a little bit differently. We only use E, they use AE. Shows what an ischemic EKG looks like. See, that has the weight, the very last wave that's up now is down. Then infarction, that actually is when the cells are actually dying. That's when someone's actually having a heart attack. And that's what we call a STEMI. We call it, what you call a heart attack, we call a STEMI. And STEMI stands for ST elevation myocardial infarction. And myocardial infarction is a heart attack. So you'll hear people say in the hospital, we have a STEMI alert. That means we have someone who is infarcting, and suddenly all the resources in the hospital will get moving. So this shows what does it look like on your EKG when these different things start happening and this blood flow actually gets blocked. And so this is what we call a STEMI or a heart attack. Now let's talk about the brain, because the concept is similar. So it's the same concept of plaques and blockages. It's just somewhere else. So usually it's in your neck, it's in the vessels that actually lead to your brain. Sometimes it can be a clot that dislodges from your heart, particularly if you have an abnormal heart rhythm. So when it actually occurs, it blocks one of the cerebral arteries. There's many of them, but it'll block one of them. And then that area of the brain will not function. So that is how come people will get either weakness or they'll get a facial droop or something along that line. So these are the symptoms to watch out for a stroke. And they use the acronym BFAST because these are recognizing the signs and symptoms of a stroke. Now, this is probably the most important slide in this entire presentation because be fast means do that, be fast. It used to be that when someone had a stroke, we couldn't get their function back. Nowadays, we can get their function back, and we can only get their function back if they be fast about it. So what does be fast mean? It means if you have a balance problem, sudden loss of balance or coordination, if you have problems with your eyes, the E is for eyes, trouble seeing, F, a facial droop, A, arm or leg with weakness, S is speech, you have trouble either speaking or understanding speech, and T is time, call 911. Time is brain. So don't wait and call 911 immediately. We need patients to get into the emergency department inside of 2 to 3 hours for us to actually really make the most dramatic difference. And we have had people who have had arm weakness, leg weakness, facial droop, and have completely recovered back to normal because they got in quickly. And this is really, really important. So how does that happen? So one of the things that happens is we are now giving clot busting medication to people with a stroke. They're called thrombolytics, and they break up the clot. And that's basically what they do. And once the clot breaks up, the blood flow is restored and some or all of the function is restored. Now, we also have interventional radiology where they actually go and get the clot. So just like they actually put a catheter in your artery in your vein and go up and look at the arteries in your heart, they can do the same and look at the arteries in your brain and literally capture that clot. They capture it with a mechanism there that I showed the catheter there and how they capture it. And they capture it and they pull the clot out. And it restores blood flow and your brain recovers. So it's really, really important. This is therapy that, 20 years ago was not available. So this was not something that was available. You just, you had a stroke, you took some aspirin, and then they sent you to physical therapy and hoped that you got a little bit stronger over time.